think, it's been a long time coming. I think it's been something that we planted a seed 4 years ago, just to get it, to see it come to the point that it is now that we're ready to bring the product to market. One, it excites me, but also two, it scares me about the magnitude of how big it can be, not only for us personally, but what it can be for the continent. I think what brought, Gerard and I together was we had a commonality and sense of purpose. We always envisioned something better for our people, and we knew that we couldn't sit here and expect somebody else to be the ones delivering the service, but we had to see how we could look each other in the eye, look ourselves in the mirror as well too, and see what we could create based on talents, skill sets that we've had privileges of accumulating over a lot of the years. So obviously we're experts in pharmacy practice, so that was our vehicle that we used to kind of bring it to fruition. But it means a lot knowing that we've come so far, but we still have so far to go. And I'm sure, Gerard probably feels the same way about it.
Yes, just emphasizing a little bit on the vision too. It's something that today we're talking about. The Gambia. It's just the beginning. We kind of see this, evolving into an African thing. Who says Senegal, Guinea-Conakry, Guinea-Bissau, eventually all of West Africa, Central Africa. Why not? So it's something that we're mindful of, and as he says, as African, that have been living in the West for so long, you get to a point where you start to find meaning, and this is particularly true for some, or maybe not all, where you get to the point where you start to realize that hey, you have a people back home that kind of need your services as well, and so to have that heart to do that, to come together, for that vision too, is it's something special, and it's scary at the same time, but it's very interesting, and it's something that we're looking forward to, and we live every day, knowing that it could, we could go from one country to two countries to three, who knows, to the whole of Africa, to the whole of Africa.
Yeah, and I think it goes without saying, but I think we'll be mistaken if we don't say that it's people who took the courageous steps before we did on the continent. We've had opportunities to go back home to the Gambia and see young people our age who took the risk, who sacrificed comfort, and went back home and have created something that they could be proud of. So part of it is us, we commend the ones who started, that journey back home, but now we want to be in the arena with them and hopefully sow more seeds where now people could see themselves in us. It doesn't have to be healthcare, but it could be any kind of service that you feel like you've reached, attained a level of expertise now that you could commercialize it, one, but also take it back home where now we could dominate certain industries on our continent, because I think the concept us, for us, by us is something that we believe in as a company, because we believe like our people deserve better. And only it has to come from within. I think it's a culture of looking at what we could do, and hopefully we create a product that could be something else.
Okay, and especially speaking about something coming, the drive, the passion coming from within, companies operate on the whys most. What are your whys to doing this? Why Novrex?
I think the biggest why for me is why not, right? So why not? The disparity has happened for so long where just by virtue of you living on the continent, you're predisposed to less than, right? So why not create an environment where the same level of service that you could get in Charlotte, in New York, in San Francisco, you could get the same level of service in Banjul, Basse, Mansakonka. Why not, right? So why not create an environment where now, if you live in the diaspora and you're caring for somebody back home on the continent, you have a vehicle that you could utilize to ensure the same level of services provided. So my why is deeply rooted in why not. And it has to start from us in creating something that we could be proud of, for sure.
For me, it's more the African in me. sometimes I almost have to, kind of curb my thinking and my words to make sure that I don't sound too radical. And this doesn't come. It comes from a place of pride. Us Africans, a lot of times, living abroad, we're so easy, to accepting, the culture of, of where we are, and we're so easily, taking into forgetting where we come from. So for those of us that think, and we want to be able to encourage other people in terms of, hey, we can do this, as Dr. Badjie said. His why is in why not, and I kind of second that too, because I believe that, us Africans, if you look at the stats, just statistically speaking, somebody, the life expectancy of people in Africa as opposed to here is huge. There's a huge disparity in that. So when you start asking those questions, you start to feel this strong sense of service, a strong sense of calling. Say, hey, you could actually be able to have an impact, and that's that's the why. That's my own why. On that, seeing that, hey, I could be a part of something that could actually, increases people, that would actually increase people's life expectancy.
Which drives me to ask, what is the vision here? What is NovaRx's vision and mission?
So I think our vision, to make it simple, we want to create a world where quality and access is an afterthought on the continent. Meaning, from a healthcare standpoint, any service that you're getting that's health related, is it something quality? Do I have access to it? It's something you don't have to contemplate whether or not it's for you, right? I think it's rooted in that, because anywhere else in the world, if you're buying a product, you have access to it, it's quality. It's only on the continent do you start questioning, like, hey, is this something of quality? Is this something that I have to be privileged to have access to? So my vision is deeply rooted in an ecosystem in Africa where quality and access is something that we don't have to worry about anymore. But most importantly, Africans are at the forefront of providing the service. That, honestly, that's where I think about it. So that's why we're branding, the company is designed to be a healthcare solutions company. Yes, we're experts in pharmacy, but in terms of medical tourism, telemedicine, electronic health records, diagnostics, there's like a whole array of services that I envision us being in the position to usher that on the continent, for sure.
For me, I mean, if you look at the world today, you look at statistics. I mentioned earlier on the disparity in just life expectancy. Now, for so long, for me, I mean, today, so long, Africans' history, or Africans, our day-to-day lives are the happenings of our continent has been narrated by different people. This is an opportunity for us to write our own stories, to make the changes that we know we need, to tell our own stories the way we want them heard. So that alone, it's also a big impetus into into why we're doing this, for me.
All right. Any last words?
No, I'm excited. I'm excited. I think it's something, my mom used to always say, well, a proverb, but I think I could extend that proverb to kind of, which the proverb translates to, before you know where, how much luck or opportunity you have, you put in the work on your own. But also I'd feel a sense of responsibility. So it's not going to solve all the problems, but it's my way of, sowing my seed that hopefully could motivate somebody else to sow their seed, and together we could create an Africa that, our kids could be proud of, and an Africa that we don't have to look outside just to see something good, but we could look within to feel something good.
And to piggyback on that,
in that token, in that token, for me, there's a lot in the news of Africa, of Africans immigrating, crossing the Atlantic to come on the other side. Just in that same light, I come from a background where my dad always used to say, hey, you cannot know where you're going to unless you know where you're coming from. It's an opportunity for us, to go back. And not only actually learn and know more about our people, so we'll be able to provide these services and do things for them that is going to improve our status as as Africans, and improve us as a people.
Cool.
Thank you.